Symptoms of Parkinson's disease are very diverse. I often say that Parkinson is a condition which affects almost every single system of human body. The major symptoms of Parkinson's include slowness in performing movements, which is also referred as bradykinesia, stiffness or rigidity, resting tremor of the limbs, and also the balance issues. These are motor symptoms, but in addition to them, there are many other symptoms which are related to different systems of human body, and they are referred to as non-motor symptoms. The list of non-motor symptoms is growing as we are learning more about Parkinson's. For example, speech problems. The speech becomes soft in patients with Parkinson's. They may have start hesitation when they start speaking. They may stutter. They may have slurring. They also lose the variation in tone, which is called monotonous speech. Mood disorders such as depression, anxiety, lack of motivation, and panic attacks could happen. In addition, problems with memory and cognition, especially in the beginning, patients may have trouble arranging and organizing tasks. Delayed reaction time is also a symptom of Parkinson's. As the disease progresses, patients could develop psychotic issues such as confusion, disorientation, hallucinations, which can be worsened by medication use. Sleep problems are also commonly seen in patients with Parkinson's disease. They have multiple awakenings at night and they have excessive daytime sleepiness. Also, REM behavioral disorders in which patients are enacting on their dreams, they are yelling, shouting in sleep, and they're moving their limbs. They may be choking their sleep partner. Skin problems such as dry skin, bladder dysfunction, as well as sexual dysfunction, lightheadedness or dizziness when they stand up, excessive sensitivity to cold, episodic sweating. Patients have drenches of sweat. That is all due to autonomic dysfunction. Also, patients could have loss of sense of smell, and many patients report that the loss of sense of smell has been there much before other symptoms. Pain and sensory symptoms such as numbness, tingling, is also the symptom of Parkinson's disease. Sometimes the contractures can develop and dystonia can happen in patients, especially in the limbs. Joint and skeletal deformities such as scoliosis and sometimes osteoporosis can worsen in these patients because they are not mobile. And as the disease progresses, they could develop hand and foot deformities. Frozen shoulder is another symptom which occurs usually on the side where Parkinson started. And also difficulty maintaining balance, unsteady feeling on feet, freezing of gait when they're walking, their feet seem to be stuck to the ground, fascination is walking faster than normal, and also freezing. These are symptoms of Parkinson. Some of the symptoms related to gastrointestinal tract are swallowing problems, constipation, drooling, poor dental and oral health, nausea, vomiting, and eventually weight loss could happen. Some patients in late stages could have double vision or dry eyes or less blinking of the eyes, which can cause inflammation of the eyelids. There are many other symptoms of Parkinson's, such as internal tremor. Patients feel there is a tremor inside their body. Other people cannot see it. Facial expression can be reduced. Their eye blinking is reduced. Their handwriting becomes small. And because of sitting or medication, they can have swelling of legs. Some patients have fatigue and loss of energy and also leg cramps. And restless legs syndrome also happens more frequently in patients with Parkinson's disease.